Hi there, real talk for real people looking for real solutions as we're inside of a pandemic. I'm Tanya Rivens, and this is Canceling COVID. Thanks so much for joining us as we work together to build stronger families and communities in the middle of a crisis. I mean, it's a global pandemic that we're dealing with, and a major development. This is huge in the fight to cancel COVID. Anyone 16 or older can now get a COVID vaccine. 16 or older, and appointments in Mecklenburg County, they were in such high demand. Oh, it crashed the website for StarMed. Yeah, on Tuesday, so many people were trying to get their appointments for a vaccine. It's the healthcare provider that's administering the vaccines here in the county, and they're doing it at Bojangles Coliseum. Now, other vaccine appointments sites like CVS, they were also experiencing some site delays this morning. So you can see the demand is there, and lots of people are looking to get vaccinated, which speaks to we just want to get back to our new normal. And there's a lot of anxiety around how quickly can we get there. But we need to kind of pause and make sure we're doing what is proper and what the professionals are telling us to do. That leads to our question of the day. Are you optimistic that the worst of the pandemic is behind us? I'd love to hear your thoughts on that. Do you think we have rounded that corner and we are headed towards the light and that we are good? A lot of people feel that way, but I'd love to hear your thoughts. And my thoughts, we still have some work to do. But again, listen to the experts and follow their directions. You know, we've been at it this long. What's a little while longer? That's my take on this. Now, all this comes as President Biden. He says that 90% of the country, get this, will be eligible for vaccines in the next 3 weeks. So that's right before May. And again, the weather is getting nicer and everybody wants to get out and enjoy, family, the weather, get with family and friends, that's for sure, and travel, and looks like travel is starting to pick up as well. So with more people getting vaccinated, are you more hopeful again that the worst of the pandemic is behind us? Hop in our chat. I see you guys hopping on. I appreciate that. Share your thoughts on that. It's always great to share that online with everyone as well. So optimism certainly is growing out there, and more states are reopening. Others are easing restrictions at the same time. The CDC director is concerned. I saw that interview, quite concerned about a fourth surge. I felt her heart on that one too. It's like, come on, guys, this fourth surge, and it's warning us to take all the precautions. Take a listen as she explains.
I'm going to pause here. I'm going to lose the script, and I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now, I'm scared. I know what it's like as a physician to stand in that patient room, gowned, gloved, masked, shielded, and to be the last person to touch someone else's loved one because their loved one couldn't be there. I know what it's like when you're the physician, when you're the healthcare provider, and you're worried that you don't have the resources to take care of the patients in front of you. I know that feeling of nausea when you read the crisis standards of care and you wonder whether there are going to be enough ventilators to go around and who's going to make that choice. And I know what it's like to pull up to your hospital every day and see the extra morgue sitting outside.
Now, those are some real powerful words. And again, I feel her. I can feel her heart in those words, and it's pretty powerful. And what else can we do? We have to be obedient and understand, again, these are the experts, and we just can't go backwards. We've come too far. So I'd say let's kind of slow our roll a little bit, and let's focus on what's important to getting back to the new normal once and for all, instead of having to make progress and go back. And I'm so grateful, because she put a more human face on what people often think are, they're just professionals. They're just doing their job. But, she shared her true feelings right there about what's going on. And hopefully that's enough for everyone to take heed and start just being a little bit more patient. That leads me to our first guest, who I'm excited to bring on. It's Mr. Ben Money. He's the Deputy Secretary for Health Services for the state of North Carolina, the Department of Health and Human Services. And I already said I love the last name, Mr. Money. I appreciate you taking the time to talk with us. So good afternoon to you, sir. I know you rushed from another meeting, so I'm just honored that you hopped on with us.
Good afternoon, Tanya. Thanks so much for inviting me to your conversation today.
Absolutely. So, what's your initial thought when hearing such a dire warning from the CDC director? What would you say, or how do you feel about that?
Well, I think the first thing I say is I really appreciate her empathy and her compassion. As a practicing physician, she has seen death and she's seen the suffering. And I think her concerns really come from her heart. And it also, comes from a place when, we remember the warnings and concerns that we expressed prior to, the Thanksgiving and Christmas holidays.
Mhm.
Recognizing that there would be a lot of pent up desire among people to see their families during that time, but also recognizing what that meant in terms of viral transmission for COVID. And, in spite of our warnings and our guidance and people did. They gathered with their family members for the holidays, and we saw the biggest spike that we had, in the pandemic thus far. And so I think when we see photos from spring break in Florida,
Yeah.
and we hear about other states that are dropping mask mandates, we I think what she's seeing is that there's the potential to have a repeat of what we experienced over the holiday, which was only 4 months ago.
Right, right.
Uh, how quickly we can forget and let our guard down. I really appreciate an analogy that Governor Cooper made, where he said, let's not spike the ball. We haven't crossed the goal line yet.
Right, right.
And you've probably seen all those sports, memes where people have done that, and they've celebrated too soon, and it's we can feel uh, you know a, a, a change. We can feel and look forward to uh, a time of celebration in the not too distant future. It's just not right now.
Yeah, and a lot of times doctors take heat for not having that bedside manner of communicating, but she actually hit the ball out of the park on that one, and I was very grateful because it even makes you stop and listen. And when I heard it, I was like, "Oh my goodness, let me just turn around." So we're kind of tasting what we're headed for, but we just need to hang in there just a little bit longer so we can get
Right.
the full taste of what we need. Now, in the interview, she talked about how COVID cases are climbing. 2 weeks ago, the national daily average for new cases was 53,000. This week, it hit 61,000. What trends are you seeing here in North Carolina?
Well, our trends are actually moving in the right direction. We're seeing our cases go down. We're seeing our hospitalizations go down. But we're also, mindful of what transpires around the country, because while we may have, lines on a map, the
Hmm.
virus doesn't respect those lines on the map.
Right.
And, as people begin to travel more, there's more opportunities for, the virus to spread across the country. But the things that we've been doing, that North Carolinians have done around practicing those 3 Ws, wearing a face covering, washing our hands, waiting 6 feet apart, really has helped to slow the spread of the virus, as well as getting vaccinated. Right now, um, there are 35% of adults in the state that have received at least the first dose of the vaccine, and that's really helping to slow the spread, particularly among our elderly population. But one of the things we know is that there are new variants of COVID-19,
Right.
and while the vaccine has been shown to be effective against the emerging variants, it's really important for us to get people vaccinated as quickly as possible so that we really can turn the tide of this pandemic.
Well,
But until we do, those 3 Ws, those protective measures, are the things that we need to continue to practice.
in their way of life now. I can't imagine why anyone is still pushing back on that. And obviously, we are reaping the benefits of it. I see Erica Simonton Beatty has hopped on. Good afternoon. And please chime in with our question of the day. I'd love to hear from you, share your thoughts. Are you optimistic the worst of the pandemic is behind us? Now, Mr. Money, I wanted to ask about the trends. Ours are going in the right direction, but are you all seeing any that would concern you and that we should be concerned about?
Well, we monitor trends on a daily basis, and our cases are really the first thing that we look at. I would encourage people to continue to get tested. We have testing uh, opportunities across the state that are free, and you can go to our website to access that. So if you feel like you've been exposed to COVID or if you have symptoms, we want you to go ahead and get tested. It's important that we have that testing, and there's even rapid testing available now. And our regular PCR testing has pretty quick turnaround, so you can get your results in, typically in 48 hours. So encourage folks to get tested, and importantly, get a vaccine. We're going to have that vaccine available to everyone very shortly.
Yeah.
Right now, supplies are limited, but we are anticipating in the next really couple of weeks having significantly more vaccine than the state, and really want to make sure that folks make a plan to get vaccinated.
And I see that the state is also, there's a campaign to get others vaccinated. I don't remember the exact line about that. And I thought that I saw where you can go online and even order a kit for free for those to have them sent to their homes to be tested. Is that correct?
Yes, that's right. That's right. And so as of today, all essential workers that have not yet been vaccinated, or people that are living in group settings, such as college students in dorms, are eligible for getting vaccinated. And then next week, on April 7th, all North Carolinians aged 16 and over will be eligible for the vaccine. And we've got resources on our website, yourspot.yourshot.nc.gov, or you can go to the www.ncdhhs.gov website for more information. We have a place where you can go to actually find a vaccine, or you can call our 1-888 number, which will actually connect you to a live person to answer your questions about the vaccine and get you connected to an appointment. And that number is our COVID-19 Vaccine Help Center, 1-888-675-4567.
So I've got one more question for you, but I want to throw this in. Do you feel like the state is pushing the vaccination more so, and now testing is not getting the attention that is needed?
Well, we know that the vaccine is really our way of ending the pandemic. Testing is a way of identifying someone that does have COVID and being able to isolate them or quarantine them, so that they don't spread the virus. But the vaccine is really key. I think the challenge we've had since the onset of our vaccination effort is we've just not had enough vaccine to go around to everyone. And so we've had that prioritization schedule based on who's at highest risk for exposure to COVID-19, and then who's at highest risk of hospitalization or death if they contract COVID. But with vaccine supplies becoming more plentiful, we really want to make sure that everybody puts that priority on getting a vaccine. There's 2-shot vaccines like the Pfizer and Moderna vaccine, and then there's 1-shot vaccine. So folks who are adverse to needles, or they or just want to make sure that they can just get it done and get it over with.
Right.
That Johnson & Johnson vaccine is a great option. So more options, more vaccine, and making more sites for vaccination available as well.
So myspot.nc.gov. So Erica Simonton Beatty says, with the vaccine being more available, she believes the worst is behind us, but she does feel we should still be cautious with our daily activities and continue with the 3 W's. And so I'm going to ask you the same question, but you pretty much answered that leading up to this point. If you are optimistic, or pretty much optimistic, that the worst is behind us now with growing vaccine access, do you think that if we stick to the plan, we should be okay, or we're going to have to do more than just because I see some of the numbers, especially in the challenged communities, minority communities, they're slow on getting the vaccine. So if they are not getting the vaccinations and we're still practicing our 3 W's, would you say we would get to a standstill? And I even throw in the whole herd immunity theory, which I'm still trying to process and understand that. Do you care to comment?
Yeah, I certainly do. So it's important to know that COVID-19 is a new virus. So we don't, all we can do is anticipate what other viruses do and project that out to COVID. But, we don't have really a lot of foresight as to what COVID will do and how it will respond. I think this time last year, there was a optimism that COVID would die down like a lot of coronaviruses do in warmer months.
Right.
But we could just look to Brazil and what happened during their summer, which actually happens in December, January, and February, to see that they had an increase in cases. And that's the thing that we saw. Our summertime spike actually happened in like June and July. So the thing that we've seen thus far is every time we think that we're over, we're in for a climb. And that's why I think Dr. Walensky was being very, very guarded in her comments about, her fear that we would drop our guard.
Mm-hmm.
I think it's also important to really recognize the fact that so many people have suffered as a result of this pandemic. So many deaths. So many people that have been infected with COVID that have long-term consequences.
Yeah.
There's been such economic loss and personal loss.
Yeah.
We don't want to prolong this pandemic. I think the key thing is let's be vigilant now. Let's focus on the things we know that work. Get our vaccinations in at your spot, your shot.nc.gov. Make sure you go there and get signed up to get a vaccine, and get others to do that as well. One of the things that we've been particularly doing is making sure that there's vaccine access in communities of color, because they've been, number one, hardest hit as a result of COVID, because they overrepresent in frontline workers and have higher percentage of individuals with chronic diseases that are impacted by COVID.
All right.
So we've been really utilizing our data to allocate vaccines to communities that are currently under-vaccinated, so we can have equity in terms of our vaccine, not only distribution, but also our vaccine administration, and really working with providers to understand their communities and holding them accountable to actually vaccinating based on the demographics of their population. So if their population, let's say, is 30% African American,
right,
we want to make sure that 30% of the vaccines we give them at least are going into those arms.
Well, so I know that we have been told that if you have the virus, you shouldn't take the vaccine. And I've got to start wrapping things up, but you're giving us some great information. So someone is asking, it's Reverend Franklin Russell who has hopped on. He says, ask if a person can take the vaccine if they have the virus.
Well, the thing that we want to make sure is that they're not symptomatic. And there are a lot of people that are asymptomatic. They're walking around with COVID and they don't have any symptoms.
Mm-hmm.
It's important to note that if you're symptomatic, getting the vaccine is something you want to consult with your physician. First of all, you want to be, in a position where you can isolate so you're not spreading the virus to other people. We don't feel like people need to get tested first to get the vaccine. So if you're not symptomatic, just go ahead and get the vaccine. We want to make sure that folks understand that the vaccine is available to everyone, and we want to make sure that they know it's free and they don't need to have an identification. We also want them to know that if they're getting a 2-dose vaccine, that they will be reminded to get that second dose and actually given that appointment when they go in for the first dose. That second dose will be available for them.
So are you saying that if you have the virus, then it is okay to get the vaccine, or you're saying consult your doctor first?
What I'm saying is if you know that you're symptomatic for COVID, if you've been tested and you've been tested positive, first of all, if you have symptoms, go get a test. If you get a test and it comes back you're positive, you need to stay home, quarantine, isolate, and then when your symptoms subside, get the vaccine after that. Right. If you don't have symptoms and you don't know you have COVID, you don't have to get a test. You can just go get a vaccine.
Okay. So that's one of the things that we've talked about on here. And I know, gosh, I could talk a whole segment with you. We only have 30 minutes, but I want to just touch on, I mentioned earlier the website for Mecklenburg County at StarMed, who's giving out vaccines. When they opened up for appointments, the website crashed. Is the state looking, to make the vaccine appointment process? Or are they trying to figure out a way where it can be seamless and talk how it's working for others that around the state that are trying to get them? And have y'all witnessed this in other areas?
Yes. In fact, one of the things that we've done is we're creating and have actually created a centralized scheduling system that's available for providers. But one of the things that we know is that, many healthcare providers have their own electronic medical records and
Right.
they have their own appointment systems that they utilize. There's been such tremendous demand for appointments that, it has put a strain on some systems. And I just want to commend our vaccinating providers in North Carolina. They've done a tremendous job. We're a little over 3 months into our vaccination effort. And just to think that, we're, over 30, a third of the people actually getting at least the first dose. That's a tremendous accomplishment. This is the largest vaccination effort in the history of mankind.
Wow.
I'll say that again. The history of mankind. This is huge.
That's huge. I was getting ready to say, but hats
Right.
off to you all as well for being able to put it together and sticking to your plan in spite of all
Mhm.
that has come at you. You've maintained and done a really good job. The Everyone's 16 and older next week. It's available, I believe, April
Yep.
7th. So when will they be able to start booking these appointments?
They can actually start booking them now. In fact, I utilized our website to have a reminder sent to me.
Uh-huh.
And I put myself in several different ways so I could see when the reminders come out. So I just got a reminder today about Group 4 opening up.
Oh, good.
So if you go to our website and go to vaccine, find my group,
Uh-huh.
then you can actually put your cell phone in or your email address, and it will send you a notice when your vaccine group is eligible.
Findmygroup.nc.gov. We're gonna wrap
Yep.
things up. Hopefully, we can get you back sometime, Mr. Money, because this
Love
is
to.
ongoing. Yeah, it's great talking to you, and I think having someone, well, I know having an official from the state that's actually around, that's putting these policies together, it really helps because now you're getting the facts, and there's so much misinformation. Reverend Russia says thank you for that question had come up with one of his parishioners, and he really didn't know the answer, but he told them to check with the primary physician. So, any final thoughts as we wrap up with you? And again, I appreciate you.
Well, I'll just say it again. Let's do the things that have gotten us here thus far, wearing our face coverings, waiting 6 feet apart, and washing our hands, and getting the vaccine. Now we got a fourth thing to do.
All right.
3 W's and a V,
All right.
right?
But I think you can put your V's up and then figure out on your fingers how you put a W up. It all works for the good. So thank
There
you,
you
Mr.
go.
Ben Money with the State Health and Human Services. I appreciate you taking. And again, that's a commitment to what they are saying here in North Carolina. We're going to cover all bases. We're going to talk to everyone, and we are going to keep you informed. And that's some really good dedication. I would say they're dedicated to us getting back to our new norm and making sure we do it right so that we don't have to start over. So we know everybody's not going to be on board, and we just have to keep pressing forward. Now, we have real talk here on canceling COVID, and you can't get even more real than taking a look at the damage this virus is doing to our bodies, even after recovery. Just a whole lot happening. And the one good thing about it, you can't get more real than our guest is coming up now. She joins us every Wednesday, Dr. Tracia Black, and she's with Groundwater Solutions. It's always great to talk with you, and I appreciate how you always are, you have your pulse on what's happening. So before we go to that, any thoughts on comments from Mr. Money and what he just shared?
Yeah, so I have a lot of respect for Dr. Ben Money and the guidance and leadership that he provides at Department of Health and Human Services on the public health side. And I know that in their mind, the push is to be CDC clearly says that if you are COVID positive, you should not take the vaccine. And the challenge is that a lot of folks are asymptomatic and they don't know it, but I think the state doesn't want there to be a delay in vaccination. So let's not see whether you're positive or not. And the challenge is the damage is still being done, even if you have no symptoms. And so I want to explain a little bit about what happens to your body when you contract COVID. So the COVID invades your cells, healthy cells. It's like hijacking your body, and it begins to duplicate itself. So the COVID cells are building in your body, and they can potentially kill your healthy cells. They're going to travel down your respiratory tract and invade your lungs. Now, some people, depending on your weakened immune system, will develop symptoms, and some people won't. And we know what those symptoms are: coughing, fever, all those different things. But that doesn't mean that if you have no symptoms that the invasion is still not taking place. Your lungs become inflamed, and then the amount of oxygen that goes out to your blood is reduced. And then the amount of oxygen that your blood delivers to your organs is reduced, even when you can't feel it. So it's almost like diabetes or high blood pressure, what they call the silent killers. So it's still sucking oxygen out of your body and damaging your organs. We know that it causes kidney damage, liver damage, even if you don't have symptoms, damage to your heart, even if you don't have symptoms. That's why, initially when you would go into any doctor's office, before they let you in, they're checking your, pulsometer to check how much oxygen, because you might feel fine and they read and like, your oxygen level is reduced. So the damage is taking place, and we know that there's long-term damage. Recent research shows that African-American life expectancy is reducing by 3 years. Because of COVID-19. And they expect that over the next 2 to 3 years to increase to 5-year reductions in our life expectancy. And it's even higher for Latino populations. So it's dangerous to take the vaccine when you have COVID. At our sites, we do a rapid test where results come in within 15 minutes. If that test is negative, we then administer the vaccination. But we think it's very important that testing occur before the vaccination. So that's one point with Dr. Money that I would disagree on. And I know that there's the push to get the vaccine in arms, but I think it's important to tell people the reality of what's happening.
Yeah, and he was providing great insight and information. You mentioned, I saw where COVID has been declared. It was the third leading cause of death. That's pretty powerful as well. But there are a lot of people now who have gotten vaccinated, and they kind of think they're invincible. What would you say to these people? They're vaccinated, but they are not trying to take any precautions anymore.
Well, again, and I don't know if Dr. Money referenced it specifically, but if you're vaccinated, you can still get COVID. It's like the flu vaccination. You can take that vaccine every year and you could still catch the flu. You can still pass the flu along. And so with the vaccine for COVID, it's the same thing. You can still catch it and you can still spread it. So if you're positive, it's important that we continue. He said to continue doing what got us here. And what got us here is early detection, testing to see if you have COVID, and quarantining. There are so few people who are now quarantining. And again, he said there are lots of people who are walking around with COVID-19 today and have no idea that they have it, and they are spreading the virus.
So the Trina Little hopped on and she said, "Hi, Dr. Black. Good to see you."
Hi.
So let's talk about the question of the day. Do you think that the worst is behind us now that the vaccine access is being opened up and it's increased and everybody's got an opportunity to get it? Well, 16 and older starting next week.
I hope and pray that the worst is behind us. I believe the worst should be behind us if we keep doing what Dr. Money said and practicing what got us here. So there should not be taking steps back. If we continue with the vaccinations, continue with testing, continue with quarantining when we need to, continue with the 3 W's, I think the worst will be behind us. I just know people. I know people better than I know most anything else. And
Yeah.
they are letting their guards down. They're not
Yeah.
practicing those things that we know keep us safe.
Yeah, we have short memories, that's for sure. Tanya Hardin just hopped on and says she was supposedly COVID positive in January. Her heart rate increased, but that was normal for her. They never showed her any positive result. You know, how does that happen where you are told you're positive, but you never got the test results?
Well, every um, program, every laboratory has a different system. And so
Mm.
some don't send out the results. Well, they should send you a positive result. If you're negative, sometimes they do not send the results unless you specifically ask for them. And so I don't know if she asked for them and it didn't come. I'm not sure what happened. I
Yeah.
think with COVID-19, most laboratories in the United States were overwhelmed. It was
Absolutely.
unexpected, and everybody had issues. LabCorp, Quest, even some of the larger labs, we all had issues at one point or another with COVID. So it was probably a laboratory error. Hopefully it's fixed now and you can go back and get that positive result, that documentation of the lab report.
Yeah, well, you guys are big on testing, and now you're doing testing and vaccinations together. So, where are you with Groundwater Solutions? Where are you out testing today?
Okay, so we are still always on Wednesdays. We're at Master Cuts off of Ashley Road, and we're at University Adult Daycare near the Sam Shopping Center.
Oh, now you have started the vaccines and testing. Like I see it as one-stop shop, which is great.
We are. Everything happens at the same time. Typically, we're going to do the rapid test. We're going to test you and then vaccinate. And then there's a 15-minute wait time. So it's usually about a 30-minute process.
So, as you gather your final thoughts, Dr. Black, I'm just going to say Tanya also said she was hospitalized for it, and discharge papers said COVID exposure. But Ms. Harden, I think to Dr. Black's credit, what she's saying is perhaps there's just some type of miscommunication on why you never received your results, and you can always go back and reach out to the lab and ask them for them. Correct?
And that COVID exposure does not mean COVID positive.
Oh, wow.
That's different.
Wait a minute. What's the difference?
So if you're around someone who later finds out that they're COVID positive, then you're COVID exposed.
Okay.
But unless you take a test and it says COVID positive, you're not necessarily positive. I was in a car with 4 people, and one person we found out 2 days later was COVID positive. The other 3 people tested, and 2 came back positive and 1 came back negative. So that negative person was COVID exposed, but was not COVID positive.
And so I understand the difference in that, but to be hospitalized for COVID exposure, is that common?
Well, I'm not necessarily reading that she was hospitalized for COVID exposure, and I may be wrong. It says
COVID
she was
positive.
hospitalized and on the discharge paper, so she might have been hospitalized for something else. So, Ms. Harding, can you give us a little bit more?
And while she's typing that, Reverend Russell says that he has a question, which is that others may need the answer to. If a person has had both vaccines, should they continue to be tested, and if so, how often?
I would say at least once per month
Okay.
until we reach herd immunity, that word we keep hearing about. And
You're
that's when at least 80% of the population is vaccinated. You should continue to be tested at least once a month. However, because we know that we're not sure, and the research is telling us that with the COVID vaccines, there's potential that we're going to have to be vaccinated every 6 months. You know, we can get herd immunity and lose it.
Oh,
So
wow.
just because we reach 80%, unless we have 80% who are consistently following that schedule, that it's not an absolute that once we get it. So until we are consistently at a place of herd immunity, you should be tested at least once a month, preferably bi-weekly.
So, Groundwater Solutions out and about and working in the community, doing testing and vaccines together, which is really good. Any final thoughts that you want to leave as we wrap things up?
No, just happy that we are progressing.
Yeah.
Sometimes we have to take baby steps, but we're progressing, and that is very encouraging. If you need us, you can reach us at 704-596-0505 or register for testing at www.groundwater-solutions.org.
Oh, thank you so much, Dr. Black. I appreciate it. Tanya just added, she said that she went in with an elevated heart rate due to, looks like AFib, and
Mhm.
she already had, and she was placed on the COVID floor because her son tested positive, and
Okay.
she was around him. So,
Okay.
some things, and everybody has different situations, so it's
Mhm.
really good. And we're trying to wrap things up, but people are really enjoying the information. So here's
Mhm.
another question. He says, "How do y'all feel about people not wanting to take the vaccine?" We talked about that.
Mhm.
That's from William Brown, and I appreciate that question. And just if you would like to comment on it, we understand the background and the hesitancy, and
Mhm.
what we say, what I say, and we promote it here. If you're not going to take the vaccine, at least know your status and get tested. And Dr. Black, you're big on
I
testing,
would, yeah, I would agree. Research and stay healthy. If you're
right?
not going to take the vaccine, do things to build your immunity. We know for our community, specifically people of color, that we are, have the diabetes, have the hypertension, have obesity. We need to start getting healthy. That means start exercising, start doing things so that we are not at risk, that we reduce our risk. So if I'm just going to still keep eating my fried foods and doing all those things, not moving, and I'm not taking the vaccine, well, I got to do something. You got to do one or the other.
Right. Well, then get your vaccine and you can head over to Krispy Kreme, my
Yeah.
favorite, and get a free donut every day. I
Mhm.
know, and look, they took some heat for that campaign as well, but I
Yeah.
just think, everybody's trying to be creative and encourage you. So, Dr. Tracia Black, again, Groundwater Solutions, and give out your phone number one more time. Sometimes people don't want to go to the website.
Okay, 704-596-0505.
All right.
And if you don't want to go to the website, you can text the word register to 797979.
Look at you, all options, all bases covered. So thank you so
Exactly.
much for that. I enjoy talking to you every Wednesday.
You as
She's the
well.
sponsor of Canceling COVID, and we're doing our part to get the word out. So you enjoy your day. Looks like Reverend Russell says when his church doors open again, if a person has not had both vaccines, they cannot come in. So that's
Wow.
interesting that, they're making these decisions. Tanya says she's a wellness coach, and so she's going to take the vaccines. And William Brown says thank you for that response. So Dr. Tracia Black, again, thank you so much for joining us. We appreciate it. Canceling COVID, that's what we're doing here, folks. Getting you the information. Y'all are chatting it up today. I love it. I love it. I love it. Maybe it's because Friday is Good Friday and we won't be able to be on. We're going to give you an opportunity to enjoy the holiday. So if my producer's okay, I'm just going to cover a couple of other things. Tanya Harden says thank you to Tanya and Dr. Black. Thank you, Miss Harden, for hopping on. And I see you spell your name T-O just like me. Tell people that's how you really spell it. I appreciate that. North Carolina is extending its eviction moratorium also for 3 more months. And, that's a tough one too, because as someone that's a landlord that speaks from experience, and then you've got people that really need somewhere to live. And so, it's a tough call, but we don't want people homeless. So Governor Cooper has signed an executive order to speed up unemployment processing and extend the sale of to-go alcohol. Okay. All of that is important. He says people are still struggling. They are throughout the state. But how alcohol fits in that, I guess that's an option. Okay. And I see you guys are still commenting, so I appreciate that as well. Thank you, Reverend Russell. Appreciate you hopping on, and everybody that hopped on and shared their comments. So we're going to wrap things up. I love chatting with you. Again, this Friday is Good Friday. And as a believer, we're taking the weekend off in honor of Resurrection Sunday. So whatever you decide to do, don't forget, though, we're normally here on Wednesdays at 1 o'clock and Fridays at 1 o'clock. So as I always say, life's challenges will make you better, not bitter. It's Canceling COVID. We're going to continue to bring you real talk and real solutions. I'm grateful for the Health and Human Services Department of North Carolina and Dr. Tracia Black, Groundwater Solutions, for joining us. Have a good day, everyone. Stay dry here around the state. We've got lots of rain. Together, we will cancel COVID.